Well, good morning. Thank you for coming out on this very cold morning. I really appreciate it. My name is Jeremy. I'm the CEO and one of the co-founders of Sansoro Health. We're based in downtown Minneapolis. We started the company here in Minnesota about 4 years ago. We have investors from across the country. We used the angel tax credit to get some of our first investors. We are a portfolio company of Treehouse Health, which is based in downtown Minneapolis, which is an incubator for healthcare technology startups. And we're a member of Medical Alley. So really appreciate you being here. We are now up to about 35, 38 employees. I don't try to count anymore. It's too I can't count that high. Most of the employees live in Minnesota. And we create software that enables different computer applications to share clinical data. So I'm going to talk a little bit about why that's so important, what we do with it, the benefits that hospital systems and physicians get when they use our software, and then we can talk about some of the policy challenges that we face. Very few policy challenges at the state level. Would love your advice. We certainly have some policy challenges at the federal level. Would definitely love your advice on that and any thoughts you have for us. Personally, my background is my first job out of college was working in the United States Senate. I worked on health policy. I was in a whole bunch of meetings I had no business being in. I remember sitting in the majority leaders conference room in the United States Senate with all of these other staffers who had decades of experience and looking around thinking, what am I doing here, right? But also this is pretty cool. So I live in Minneapolis, and I'm in Jamie Long's district, I spent I think 5 or 6 years as Frank Hornstein's campaign treasurer. So if we think about our daily lives, data moves freely between whatever computer systems we want to use, right? You can use an Apple or a Windows PC. You can use Microsoft's customer relationship management software, or you can use Salesforce software. You can use Uber or Lyft. It doesn't matter. You can choose and mix and match different software with different hardware, and that has resulted in an explosion of better business services, better personal services, better consumer goods, right? Except in healthcare, where we've got this traffic jam. We've got this traffic jam of data, and the reason for that is not because anybody is doing anything nefarious, right? The reason for that is business incentives. That over the last 10, 15 years, the big provider organizations have invested trillions in installing electronic medical record systems. And that's been good because now we've gotten everybody to put down their paper and pens, and we've digitized information. But these systems are so complicated that to make them work, they all had to run within sort of a closed application stack, right? So it's almost as if you had an iPhone, you could only run Apple's apps on your iPhone, right? Or if you had a Windows PC, you could only run software that Microsoft wrote. Because these electronic medical record systems are so complicated. As a result of that, we spend an extraordinary amount of money in the United States exchanging clinical data. So these numbers are just for what providers, hospital systems, physician offices, long-term care facilities, it's just what they spend exchanging data. So over $1 billion in last year, just exchanging data between systems that they've installed. Over $5 billion sending clinical data to payers for payment integrity reviews, for quality assurance, for all sorts of good things, right? But it's really complicated to get that data in and out of the systems that we've built. So in my business, we call that the interoperability problem, right? And we generally think of interoperability as, hey, I go to my primary care physician, and my primary care physician has one electronic medical record system, which she uses, and then I get referred to a specialist, and that specialist has a different system, and the records don't move easily. And then I get sent to the hospital for a procedure, or I need to have surgery, and the hospital's on a different system. And so most people think about interoperability as that patient records portability challenge. We view it in a slightly broader sense, and that is, it's a business problem because we're counting on digital health solutions, better analytics, better workflow tools for providers, better tools for patients to access their own records, to know the results of their lab tests, to be able to schedule appointments. We're counting on all of those tools to help us solve the cost and quality problem that we've got in healthcare. And in other industries, we've done that through the free exchange of data, so that great big data analytics companies can come up with really important insights into, hey, you could get much better quality if you do this, this, and this, and you can lower your costs if you buy from these suppliers instead of those suppliers. In healthcare, it's much more difficult because that data is locked in silos. That's the problem we set out to solve and that we have solved. So we've created this cloud-based platform that we call Emissary. We call it Emissary because it's highly important delivery of critical data to an important recipient. And what Emissary does is it allows any kind of other application, whether it's a mobile application for physicians to use, or whether it's a patient satisfaction survey tool, or whether it's, we've probably all had to get a prior authorization from an insurance company before we could go for a procedure. It allows the data that's needed to power those applications to exchange easily with the electronic medical records that are the operating system of our providers now. So, most of the providers most of the big providers in Minnesota use an electronic medical record system produced by a company in Wisconsin called Epic. Children's Healthcare here uses a software from a company named Cerner, which is out of Kansas City. Lots of smaller physician offices use software from a company called Allscripts, which is based out of Chicago. Anyway, I guess the Midwest does well at electronic medical record software. But the point is, all of those are different systems, and they all have their different ways of getting data in and out, and it's really complicated, and our software makes that really easy. A friend of mine said, you created a Rosetta Stone for all those electronic health record applications, haven't you? I said, yeah, that's what we've done. So a single command language that the developers of all that great software on the left can use to simply integrate, easily integrate with the core electronic medical record software that the providers have installed. And our customers love it because we save them time, we save them money, we give them more complete data exchange, and that means that people get better care. Individuals get better care. They're happier. They spend less time on paperwork. There's less faxing. Pipeline RX is a customer of ours. It's a company that has virtual pharmacists. So you think about most of the hospitals in the United States, they're not that big, right? And a lot of hospitals in rural areas, and having 24/7 pharmacist coverage is really challenging, right? Even if they could find them, they couldn't afford it 24/7. So what Pipeline RX does is it has pharmacists in call centers or working from home, and a single pharmacist can help 7 or 10 hospitals at a time and look at the medication orders that the physicians are placing and be that extra set of eyes and that specialty, that specialized review of, is this the most appropriate medication for that patient? So you get a single pharmacist serving 7 to 10 hospitals at a time. Can you imagine sitting in front of a wall of 7 different computer screens, each of which is representing a different hospital? If you're not active in one of those screens long enough, it logs you out. You have to log back in, right? So it makes those pharmacists not as efficient as they could be. So they use our software to integrate all of that into a single view, makes the pharmacists twice as efficient, right? Vigilance is a great company based here in Minnesota. And they have this software that takes in clinical data from all sorts of sources, and it does the real-time triage of that data and analytics of that data, and they create a dashboard for nurses and physicians. So those clinicians can look at that dashboard and know exactly what patients need their attention most right now. So it's like an air traffic control system, right? This is what you need to pay attention to right now. Vigilance used to go to a hospital system and say, we need probably 9 months to get this installed and all sorts of different data feeds from you. Now they use our software, they go to a hospital and they say, we need 12 hours of time from your team, period. We're going to get it installed, and instead of being live in 9 months, we're live in 3 months. And the benefit is they're getting better care, the patients are getting better care, and the cost of care delivery for those patients is lower. So those are a couple of examples of the business problems that we solve and the opportunities that we enable for companies that are bringing really innovative solutions to deliver better quality care at lower costs. So the challenge for us is that these companies that have built these big electronic health record application systems, they made a lot of money doing it. And God bless them. They've invested the blood, sweat, and tears that it takes to build great software companies. But we never benefit when, in any industry, one company says, no, I'm going to control innovation. It's all going to be on my terms. Imagine if Microsoft or Apple said, you know what, from now on, in order for any other software program to read the files that you've got on your laptop, we have to approve that company. We're going to decide whether any other software developer can read and write to our file system. It would slow down innovation considerably, right? Apple has an app store for our iPhones and iPads. Google has the same thing for Android. But they've got a fair set of rules that allow anybody, hey, as long as your application is written to these minimum technical standards, and you have a privacy policy that you publish, etc., you can offer your app on our app store. That's what we need in healthcare. The policy challenge that we face is that we've got these entrenched interests now that are controlling what third-party applications can access the data, and it's not their data, it's the patient's data, right? So I actually had a company, one of these electronic medical record companies, say to me in writing last week that one of their customers, a hospital system, could not use the tool to exchange clinical data with another application that hospital system wanted to install unless the electronic medical record vendor approved of that third-party software developer. Not from a technical standpoint, just, do we think they're going to compete with us? Do we want our software to be used instead of theirs? And I read this note, and I nearly fell on the floor. And then we met with one of our customers, a hospital system in Florida, and they looked at it, and they nearly fell on the floor. They couldn't believe it. So that's the policy challenge that we face. And I tend to think that people are acting out of the best of intentions, but from a policy standpoint, innovation is critical to us delivering better quality outcomes at lower costs. Digital health solutions are going to be a key part of that over the next decade, and data exchange is the free flow of data in real time is critical to making that happen.